All right, this is to the everybody in front of their radios and the ships at sea, and including the people who are still in line back over in the food thing. Don't feel panicked to load bread with meat, but we are going to start just so we can stay on schedule and make sure we have all our discussion time on board. And I know Michelle has given speeches in all sorts of settings, and certainly anyone for whom one of those settings is a faculty group is used to people standing in the back gathering food while you talk. So as I say, don't worry about that. But I do want to get us started, and that starts with maybe a particularly fulsome introduction, because Michelle is somebody that, well, I don't want to say she's like a role model to me, because it was clear from the start that I could never actually do what she does. But she's somebody who I really thought was doing amazing stuff, even when I first met her, and we were all, much newer in the field when she was at Harvard. Even as a student at Harvard, as a PhD student, she was doing interesting things. And then when she was on the faculty, she was somebody who was really modeling what we would eventually call public health law research should be, the melding of empirical and scientific approaches with incredible legal chops and sophistication and understanding how law works. Michelle, when she was at Harvard, she and I were essentially became collaborators on starting the public health law research program. She was part of our methods core. And throughout, one of the wonderful things about the public health law research program was it was such a collaborative effort. Jen also, and Jen Ibrahim, it's very hard. There were a lot of good ideas. It is really impossible to say who had most of them, because they all came out of this collaboration. I kind of feel like that probably a lot of them came from Michelle, though. And now, after having sort of conquered the public health world at Harvard School of Public Health and really established yourself as an expert on law and healthcare and public health, she then decided, well, that's enough of that. Now I'm going to try law schools. And law schools have not always fully appreciated health law as a field, and particularly the most elite law schools. So the fact that she could go to Stanford, which is, I've heard, a very elite place, and which, was not, I think, particularly, centered on health law, and then bring in some other key colleagues to join her. It's now a powerhouse of health law in the law school world, and she continues to be in the New England Journal of Medicine and all sorts of other places that reach key audiences, and to do so much other stuff that I can't even begin to say. She's got, I was reading the thing. She's got this thing about author of nearly 200 articles, which is attests to her incredible productivity, but also it's not with Michelle. It's never about just publishing something to publish something because you're an academic and that's what you do. I'll finish by the thing she said to me, I think, in the airport in Austin, Texas once. And I said, well, what, like, you do such great work. What's the key? And she said, well, I think it's picking important topics and studying them properly. And then you have influence and impact, which is what Michelle has on a regular basis. So I'm really honored and pleased and gratified that she's here with us, and I'm going to turn.
License. It's great to learn how many lives were here. So this man went on to be called the father of microbiology. Put two female lice in a clean sock, tied it tight at the top, and poured it down. He had enough from the nearly 2 dozen lice that had attached and pieced it on his leg. So he stripped off the sock and threw it in the street. This experiment is disgusting on many levels. But it's emblematic of the thirst for knowledge and ingenuity that drove Van Leeuwenhoek in a scientific career that spanned more than 50 years. Born in Holland in 1632, a basket maker's son, Van Leeuwenhoek never received formal scientific training. Nevertheless, he conducted wide-ranging scientific observations and experiments that paved the way for microbiology, microscopy, and bacteriology. Ultimately, his work led to the development of epidemiology and public health, and to proof of the microbial theory of disease, and subsequently the development of sanitation measures, vaccines, and antibiotics. And from there, as we all know, came the development of policy interventions to disseminate these measures, that is, to public health law. So Van Leeuwenhoek and his itchy socks are distantly but importantly connected to our own field of legal epidemiology or public health law. And his work has striking parallels to our own in observation and measurement, in scientific testing, and in the dissemination of discoveries. Today, I'd like to pay tribute to what we have accomplished in those areas in the first decade of legal epidemiology, and to the man we might call our own Van Leeuwenhoek, Scott Burress. And I'd like to start a conversation about what's yet to come for our field. At the age of 16, Van Leeuwenhoek apprenticed to a linen draper, and he used lenses to examine threads and cloth. Fascinated by the patterns that he observed, he became interested in applying this technology to studying the natural world. In the years that followed, he developed techniques to make very small lenses, which he incorporated into very powerful but small microscopes. Following on earlier work by Robert Hooke observing cells, Van Leeuwenhoek used his microscope to generate an array of amazing discoveries. Rainwater was teeming with what he called tiny animals, what we would today call protists and bacteria. Blood circulated throughout the body. Maggots hatched from eggs rather than springing to life through spontaneous generation. He spent decades distinguishing and classifying the organisms he found. Van Leeuwenhoek taught us that in order to really understand something, to master it, to harness it, you first have to truly see it. You have to scrutinize all of its constituent parts and how they work together. And this, to me, lies at the heart of legal epidemiology. Among the key achievements of our field in its first decade has been securing acceptance among researchers and policymakers for the idea that the adoption and diffusion of laws is a phenomenon that can and should be surveilled and measured. Development of that field over the past decade has given us both the drive and the tools to closely observe and measure the law. Appreciating complexity and heterogeneity in the law is central to what we do, and so is identifying and measuring legal variables to characterize that complexity. That process helps break down complex legal processes into discrete pieces that can be studied. To do this, we need a toolkit, and for that reason, much of the first decade of our field has been devoted to creating tools, data sets, derived by coding elements of laws, standard operating procedures for creating those data sets, a set of analytical methods appropriate for studying different types of problems, and money to activate those tools in research projects. In generating these resources, we have created the infrastructure for the discovery and application of new knowledge. These tools, especially the more than 100 legal data sets now available from the Center for Public Health Law Research, like this one on naloxone overdose prevention laws, enable us to reveal structures and activity previously hidden from view. The methods that we've developed to encode laws into variables that enable quantification and modeling quickly became the gold standard in the field. Now, our enterprise of measuring the law is by no means simple. Even a single statute can be extraordinarily complicated. A series of interwoven parts, and any given area of health is touched by the law in dozens, if not hundreds, of different ways. Coders may find that laws require considerable interpretation to deal with vagueness and permit categorization. Compounding the challenge is that the law is not static. As it evolves, it seems to constantly squirm out of our grasp. Van Leeuwenhoek devised a way to glue a spider on its back so that a thread could be drawn out of its body and studied with tweezers, and a device that held a live eel still long enough to permit its circulating blood to be observed under magnification. Alas, we cannot quiet our eels in public health law research, but the development of policy surveillance methods have given us ways to measure and account for wiggles in the law over time.
The result of all this measuring and observing, categorizing, is that we've been able to help lawmakers shift from asking, should we adopt a particular type of law, to which variety of law of that type will get the best results. For example, we can advise not only simply that prescription drug monitoring laws in general are helpful, but that laws with a specific bundle of features, like requiring doctors to query the system and housing the system in a Department of Health, are most effective. One benefit of that is that lawmakers are more likely to get it right upon initial adoption of a law. But another is that those who don't get it right learn how subsequent tweaks may dramatically improve the results they get. Whereas previously, a law that failed to get good results might have been dismissed as a bad idea. Today, we can distinguish bad ideas from good ideas that have been executed in suboptimal ways. And that brings us closer to the life cycle of evidence-based policymaking that we'd like to see in the world, in which initial legal experimentation is followed by effect testing, policy refinement, and broad dissemination. In his efforts to understand natural phenomena better, Van Leeuwenhoek not only observed, but also tested. He devised experiments to test the effect of heat on bacteria, to grow bacteria in a nutrient medium in a controlled fashion. This paved the way for Pasteur's work and the process of pasteurization. In conducting his experiments, Van Leeuwenhoek was meticulous in using protocols and documenting his methods. Legal epidemiology, too, is focused on explanation and prediction. From an early stage, the field has embraced a wide range of methods of empirical investigation, both qualitative and quantitative. Early work, like these examples, communicated how these diverse methods could be applied to investigate several key questions: the effect of a legal intervention on health, factors influencing the likelihood that public health law is adopted, how laws are implemented, and specific mechanisms through which laws affect environments, behaviors, and health outcomes. But whatever the methodology, our field has demanded the highest standards of rigor and adherence to the scientific method. The insistence on rigor and the use of quality assurance mechanisms such as protocols, research teams with multidisciplinary expertise, and peer review is one of the great accomplishments of the field to date. When we began our work, there was concern within the legal academy that the explosion of interest in empirical legal studies had outpaced the training of legal scholars in empirical methods, leading to research of uneven quality. Simple descriptive studies, non-systematic qualitative studies, and overly simple regression analyses were common. So were sophisticated econometric studies that, because the investigators did not understand the health phenomena in healthcare settings they were studying, posited causal attributions and mechanisms of effect that frankly lacked face validity. Because of the guidance and resources provided by the Center for Public Health Law Research and the field's early leaders, and success in attracting researchers from a broad range of disciplines, today sophisticated, well-informed public health law research is the norm, not the exception. We'll continue to grapple with problems of causal inference in observational studies, and we'd benefit from greater attention to how our colleagues in adjacent fields like epidemiology are grappling with those problems. We'll also continue to face the challenge of how to pay for these excellent but expensive multi-investigator teams doing all of these sophisticated studies. But we should feel proud of the progress the field has made in elevating analytical methods. Van Leeuwenhoek was a basic scientist who was unconcerned with practical applications of his work. But he was assiduously dedicated to disseminating his discovery. He published 112 scientific letters in the scholarly journal of the Royal Society, productivity level we could all envy. By inviting prominent scientists of the day to confirm his observations and providing the information necessary for them to replicate his observations, he also engaged in an early form of peer review. In public health law research, ensuring that our work is widely disseminated and has practical impact has always been a central focus of the field. Even as we worked to define the field and its methods, thought was given about how to ensure research results reached and were comprehensible to policymakers. Encouraging our researchers to focus on highly salient topics was another preoccupation, because work is more likely to get noticed and used when the so what question doesn't arise. This focus inspired our work on critical opportunities for public health law that have three characteristics noted here. These criteria themselves are not controversial, but it's a shift from the norm to suggest that policymakers should apply systematic criteria in making decisions about policy agendas. Growing our impact has also meant growing the size of the field, and money, of course, has been central to that effort. In particular, generous funding from the Robert Wood Johnson Foundation gave grants to more than 80 teams and culminated in the writing of more than 300 articles. Also important has been training. Policy surveillance programs trained more than 600 people in methods of scientific legal mapping. And in addition to the legal data sets, 2 textbooks and a wide array of other methods resources are now available to the public. Finally, dissemination efforts have focused on forging really strong connections between researchers and policymakers. And wisely, we have not relied on researchers ourselves to do that translational work. Although the work of translation is never finished, durable structures are in place now to nurture partnerships with policymakers. Among these, the Network for Public Health Law, CDC's Public Health Law Program, and Change Lab Solutions. These groups have helped ensure that our work reaches and is understandable to those who can put it into action. Van Leeuwenhoek labored in a time without public health law, without indeed much that's recognizable as public health at all. There were no national health policies due to both lack of scientific knowledge and lack of administrative structures to support lawmaking. It wasn't until the 19th century that Pasteur and others proved that infectious diseases were caused by bacteria, generating momentum for the sanitary reform movement. Van Leeuwenhoek, in contrast, lived in the age of plague before it was understood how plague was spread. He had chronic diarrhea. He lost 4 of his 5 children in childhood at a time when about 1 in 3 European children died from prematurity, infectious disease, and other causes before the age of 5. He suffered from the lack of what his work has led us to create. In contrast, a child born in the US today is cradled in a broad web of public health laws. Medicaid and mandatory private insurance coverage for prenatal and preventive care, newborn screening and vaccination laws, water fluoridation laws, motor vehicle and swimming pool safety standards, WIC benefits, school breakfast and lunch programs, paid family leave laws, and countless other laws have created an environment in which children can survive and thrive. In 2017, the infant mortality rate in the US was about 5.7 in 1,000, and the child mortality rate for ages 1 to 4, about 5 in 20,000. And to be sure, these health gains still compare unfavorably to other industrialized nations and are unequally distributed among racial groups. Enormous work remains in order to ensure health equity in law and in lived experience. But the arc of progress is unmistakable. Also unmistakable is the contribution of public health law to each and every one of the major public health triumphs of the 20th century, listed here in an article penned by experts from the CDC. We've borne witness to remarkable successes in public health law, including the spread of tobacco control laws over industry opposition, and the development of evidence-based laws and regulations to reduce the incidence and lethality of motor vehicle crashes. Public health law research has played a key role in helping the public understand these success stories. We've come a long way. There are many pioneering thinkers and supporting organizations, especially RWJ, to thank for the progress we've made. But I want to acknowledge the leadership of Scott Burress in particular, and not merely because, like Van Leeuwenhoek, he is inordinately fond of the Netherlands and of peering through lenses. In partnership with our champions at RWJ and other thought leaders, Scott really articulated a vision for the new field of public health law research, and in the last decade has thrown himself into making that happen. His contributions have been heavily intellectual, but also practical. He's led efforts to bring tools and resources to others who can help move the ball down the field. He's nurtured our intellectual community and thought hard about the strategy for ensuring that our work has the greatest possible impact. And although he's very generous, I don't think he's done these things out of altruism. Rather, like Van Leeuwenhoek, Scott has a craving after knowledge. As a commentator said about Van Leeuwenhoek, his exhilaration in discovery, combined with a fearless and sure-footed interpretation of unknown vistas, is his legacy. And Scott has stoically persisted in his work when the metaphorical lice are biting. For all of this, we owe him a great debt. Please join me in thanking him. With Scott's leadership, the field has indeed come a long way, but we can do more. An agenda for the second decade of legal epidemiology I think, should focus on two things. First, we should continue to improve our methods for studying the epidemiology of public health law. I suspect randomized experiments will always be a luxury that our field is not afforded. But like von Leeuwenhoek, we should constantly strive to improve the precision and accuracy of our observation of the natural world. This requires the continued accretion of data sets, but it also requires that we stay at the cutting edge of analytical methods. And that's no easy task given the pace of development. Words like synthetic controls or machine learning had no meaning at the time that most of us were trained. Our field will continue to be dependent on the young guns to refresh and invigorate our methodological approaches. But as always, we will approach problems with an open-mindedness to the potential utility of new methods. My hope is that as we move forward, we'll no longer confine our aspirations to staying at the leading edge of historically dominant methodological fields like econometrics, but we'll begin to think of ourselves more broadly as data scientists. This not only opens up new analytical vistas, but also the possibility of exploring relationships in very large data sets. Machine learning holds a promise of unlocking legal information that remains trapped in text files and PDFs, excluded from the universe of usable data, as Scott and colleagues have described. Rather than using human coders to code a limited set of features and statutes, could we parse and categorize the text of laws comprehensively, designing algorithms to recognize interrelationships among parts of a statute and between laws and health outcomes? With the aid of algorithms, could we leverage massive data sets already in use in healthcare, health analytics companies, and genomics to learn more about the web of relationships between laws, a person's lived experiences, their genetic predispositions, and their health? In other words, is big data legal epidemiology's future? As we push out into new data sources and methods, there will be exciting opportunities to pursue analyses in two areas that have historically been underrepresented: cumulative exposure and treatment heterogeneity. Now, most studies to date have examined the effect of one type of law, and they've looked at it at the population level. They might control for a person's exposure to other laws, but they don't really study the joint effect of being simultaneously exposed to a wide net of laws. We should be thinking about how to better study interactive effects, dose-response relationships, and other aspects of cumulative exposure. We should also give more attention to subgroups. Of course, it's essential to know whether a law produces an effect at the population level, because that's how we evaluate the bang for the buck. But in an age of pronounced and growing inequality, we should also be concerned about distributional effects. We should do more study of heterogeneity in the effects of a law on different population groups. This not only provides a new way of thinking about bang for the buck, is the law producing big benefits for groups that we care deeply about helping, even if its population level effects are modest, but it also increases the chance of detecting harmful effects on some groups and of redesigning and retargeting laws to avoid them. The second line for future work lies in pulling back and getting bigger in our thinking about determinants of health and of successful health policy. Again, early work in our field has, for the most part, been quite narrow. It sought to isolate and measure the effects of incremental changes in the law. The challenge is how to think bigger and measure bigger. It is the mirror image of von Leeuwenhoek's problem. We can see laws, tiny animals, very, very well. How immunization rates among kindergartners change when we contract the scope of vaccination exemption law, or how rates of hospital-acquired infections change when we begin reporting those rates publicly. But outside this narrow lens are two juggernauts: the social determinants of health and the changing climate of our planet. Our eyes should be on these big problems. Social epidemiology has been a core part of public health studies for decades, but social determinants only became a focus of legal epidemiology within the last few years. But it was quickly recognized, to quote Scott, that actions that actually change pathological conditions have enormous potential to improve both the level and distribution of health. It's notable that a committee of the National Academies of Science, Engineering, and Medicine concluded in a report this year that the major opportunities for improving the health of children now lie in reducing child poverty, providing stable and safe housing, reducing toxic environmental exposures, improving early education, and coordinating resources across policy sectors, some of which have little to do with health and healthcare. Exploring laws relating to these critical issues represents an expansion of the ambit of our field beyond its initial focus on healthcare and core public health functions. It means that we must push more into the realm of what we've called incidental public health laws, laws that were adopted with a primary purpose other than health promotion, but that have important effects on health. Part of our study of social determinants must be understanding how the law itself has caused harm, creating and reinforcing social structures that privilege some groups at the expense of others. Law has had a hand in promoting residential housing segregation, racism, income and wealth inequalities, and disparities in healthcare access, to name but a few. Because law sometimes causes harm, our field's motto cannot be the more law, the better. Though scholars and advocates in public health law are often characterized as advocating more involvement of the state in shaping environments and behaviors, sometimes the answer may lie in the unraveling of law that is not working as it should. And that approach is likely to become more important as we further explore why disparities in health persist. I also count climate change among the emerging opportunities for our field, even though the topic is just now becoming legitimized as inbound for public health. 5 years ago, a health law colleague asked me, I think with genuine mystification, why is climate change a public health issue? Today, I think there's broad awareness of the links between global warming and mortality and morbidity due to food and water shortages, natural disasters, infectious disease outbreaks, and other causes. Further research on the health effects of global warming will, I believe, reveal an even more devastating set of impacts than we now know. This raises the question of whether our field might be able to help overcome some of the political barriers to adopting laws to arrest climate change by reframing them as health laws. Some lawmakers and voters who will never identify as environmentalists may care deeply about health, particularly the health of today's children. Public health law research may be able to help drag climate-oriented laws onto less contested terrain. So it's time for careful thinking about how we can better understand the effects of laws on the critical social and environmental determinants of health. What needs to be studied? How can we do it? How, for example, can we better understand the interactive effects of multiple dimensions of structural disadvantage and vulnerability? How can we scale public health law research globally to take advantage of cross-national variation in the law and account for the effects of international law? Answering these questions will likely require closer relationships with our colleagues in sociology, political science, and environmental law and science than we have cultivated so far. Right now, it has to be acknowledged, the prospects for evidence-based lawmaking to address health determinants of poverty, discrimination, and global warming seem dim. When our field was born, there was tremendous optimism about the appetite in Washington for evidence to inform policy. Today, there is a pronounced turning away from science and expertise, and many of us have had a what's the point conversation with young researchers. It's not easy to play the long game, but if there is to be evidence-based lawmaking in the future, there must be evidence. There will be demand for this information again in Washington, as there always has been in the states and cities. We have to be ready. We'll continue to draw inspiration from policy successes at the state and local level and strengthen our intellectual community and sense purpose. Part of that work must involve recognition of the crisis in America today, in the institutions of steward and in public policy. Government. Today, Burress and I broad range of information that undermines ongoing battle of the vaccination policy. One example of this process is how the information slowed improvement of states' laws despite very robust evidence. These problems suggest a need for introspection and conversation about how we can effectively communicate our research findings in ways that engender public acceptance. Just branding them with a Harvard logo or getting a high-profile senator to talk about them is not going to do the trick. Sterile presentations of data may not either. We should seek to learn from other fields about communication methods that are non-traditional for us, for example, storytelling and disseminating messages through ground-level social networks. And we should be thinking not only about how to communicate, but also how to involve the public in what we do. In health services and research and clinical research, a movement is afoot to make the research not only more patient-centered, but to collaborate directly with patients in the design and conduct of research projects in order to ensure that their interests and concerns are represented. What can we learn from that? In closing, our field is entering its adolescence, and that is a daunting time for parents. But it's also a time of great possibility. In reflecting on Van Leeuwenhoek's work, the geneticist Nick Lane has commented that because scientists are still arguing about some of the theories to which his work gave rise, we have at best an unreliable map of the land that enchanted Van Leeuwenhoek. But rather than be despondent about all we have yet to know, Lane concluded, we should rejoice and explore. And so should we. Today we celebrate our accomplishments, we thank the visionaries who've made them possible, and we bravely pull on our socks to see what more we can learn. Thank you very much.
Thank you. So I work in the space of trying to get information on social networks, or I think the stuff that smart people like to come up with, try to get people active. And that's something that's obviously very. What advice do you have me to expand on ideas like abortion, like harm reduction, like good public health? When people hate people that have abortions, people hate people that use drugs, and they think these ideas are bad.
Well, you know, I would hardly presume to advise someone in your position about how effectively to communicate with your constituencies. But I think one thing that I have learned as a researcher over time, having grown up in a sort of narrow-minded community and having certain conceptions and misconceptions, is that evidence is powerful in changing mindsets when it's communicated in the right way. So understanding how people come to be addicted, how they come to need abortion services, is really critical in generating the empathy and the sense that systemic solutions are justified and necessary. So to the extent that you're able to incorporate that evidence into your narrative of why we should spend money helping injected drug users or pregnant teenagers, I think that's really helpful, and it's something that you're going to be much more powerful in conveying than any of us will. But you know, I thought the example that we heard earlier about Talia, the teenagers, is, you know, that is exactly the kind of communication I think that has enormous power. It brings together a lot of facts about the system, but in a way that fundamentally resets the moral frame through which people might be viewing populations who are in need of our resources. Thanks for the question. All right, I see there are a number of cookies that are still up for grabs, so I'm going to stand down. Thank you again.